Well, I'm hoping to hear a strong defense of the public option. I'm hoping to hear some clarity and some good definition behind it. I'm hoping he talks about how it's just one option among many private options out there, and how it's really important, actually essential to reform, because it's the thing that's going to hold costs down. If we're going to mandate 49 brand new customers to the insurance industry, how are we going to make sure that they are being honest with the American people and giving us a fair price? By offering a public option. The public option is choice, the public option is competition, and the public option brings down costs. This makes a lot of sense. So let me just say that that's one of the key things. I hope he dispels a lot of myths. He just finally says there's no death panels, helps people understand that. He helps seniors understand, seniors who need medical care and actually earned medical care and have carved a way for the rest of us to be here. Let dispel their fears about their insurance being chipped away, because it's not going to be. So these are the things I hope he does, and I feel confident the president can achieve it, but it's going to be the biggest moment of his presidency, and I just hope he makes it a Roosevelt moment, a Kennedy moment, a Lincoln moment, and because I think he has the ability to do that.
Do you expect him to spell out a lot of specifics?
On the public option, I think he should spell it out, because I think it's suffering from vagueness. When we don't talk about what it is, we leave other people to talk about what it's not and what it is. And so I think a degree of specificity is important right now.
Well, I think on Wednesday, the president's going to try to sort of take back this issue. It's been very negative out here in the heartland. I think you've had a lot of Congress people that have come back and went, wow, people are very much opposed to this. And I think that the president needs to explain where he's at, too, because we haven't fully seen that. He's kind of left it up to Congress, and they're turning it into a fiasco.
I hope Obama spells out a vision and some specifics on how we're going to do it. The closer he can come to covering everyone with health care as a right, the better. I'm afraid, when we see that even the public option isn't going to cover everyone, we got to have a public option. We got to have the strongest possible plan. And I want him to be as forceful as he can. He's using his political capital to get some health care reform. Let's use it to get some health care reform that makes sense to do.
I hope what President Obama says on Wednesday is that of all the scary stories we've heard about health care, the scariest one would be that nothing would change, and that change would be stopped by special interests. It's time to get something done, and I believe the president understands that. I think first and foremost we have to say that the current system isn't working for a number of reasons, one of which is we have to have a public option to increase competition. But that's not all. I'm reading a fantastic book right now by T.R. Reid. It's called The Healing of America. And it really goes into what's happening around the world in healthcare. And it really has reinforced to me there are a number of other things that we need to do. Start with goals. We need to make sure that we insure every person and that people don't lose the health care when they have a pre-existing condition or lose a job. We also need to make sure that we're having as many of our health care dollars go directly to help people get better and not to have it go to massive administration. So a tremendous amount, I think, can be brought out of the system there that can be focused more on health care. I also think the incentives in the health care system right now are focused far too much on people doing procedures and not about getting people healthy. There are many other things that need to be done on that, but I think more than anything, the president needs to remind people now is the time to begin this process. We won't get everything done right now on health care. It's going to be a process that's going to take a little while. But I have to say that we've got to start this idea of finally bringing some common sense into our healthcare system. We spend more money than any country in the world, and we get worse outcomes. We're not covering people in need. People are losing coverage because of pre-existing conditions or they lose their job. It's time for change right now.
On Wednesday, we're hoping to hear from President Obama on health care reform, and that there will be a public option for health care and that will not be thrown by the wayside. I believe, as I think most people do in this country, healthcare costs are out of control. And everyone in an industrialized nation should have access to affordable health care. When people feel better, we work better, and the whole nation does better. And it's time that we really take a good look at that and make that possible.
President Obama should hold up to his promise that we were going to have true health care reform. And true health care reform does not mean mandating that millions of Americans pay insurance companies for their health care. I think we need to eliminate health insurance. that he should say that that's what we're doing, that we need to stand up to these big companies who are profiting millions and millions of dollars off of the people of our country being sick. And we need to move toward a system that provides health care for all Americans, comprehensive health care for all Americans, at a lower cost, and that's what the American people want, that's what the American people deserve, and that we need single-payer health care for all Americans, period.